So I would like to take maybe 10 minutes and kind of walk through my budget. I think everybody's probably seen it, and your view on it, I think, probably depends on where you stand. Not much has changed in 20 years. But I think this is a budget that will generate a lot of debate, but I think it's also a budget that's focused on the right things, and hopefully that debate, even among people who might disagree, will be productive in terms of trying to move outcomes for kids. First of all, I want to thank you for your engagement, for the OAB, for your engagement in helping me with some recommendations for prioritizing in the budget. As I said, it is a starting point for discussion. We're all going to be dealing with this for the next 6 months until the May forecast, probably till late June. And I tried to use this budget to frame the issues that I think are the most important to achieve our 40-40-20 objectives and to address really the issues of equity and opportunity in the state. Just to kind of give you a historic perspective, we've actually come a long way since 2010 in the last 4 years. So the first biennium, 2011-13, really we had a $3.5 billion budget shortfall. Every education budget was lower than it was before. On paper, the state school fund was up 6%, but we had lost $1 billion almost of stimulus money, so we were going in the wrong direction. But we were able to balance the state budget without ripping the state apart. We were able to make some structural changes. We created the OEIB. We brought the Department of Education into the executive branch. We redesigned our early learning system. We developed our achievement compacts. So we made a lot of progress in terms of trying to create the infrastructure for a seamless outcomes-based system of public education. In 13 and 15, we sort of fleshed this out, and we also got enough money in the budget to sort of get a floor under us, if you will. I think we're now, and we created the independent governing boards for institutions. The HEC got up and running. So again, we made some significant progress. And I think, obviously, the major challenges going forward involve the budget, how we spend the money, how much we spend, and where we spend it. So I'm hoping that over this next 2 years, we can begin to change the state's role in education funding from a passive funder of enrollment to an active and strategic investor in outcomes. The recommended budget has education as really the centerpiece. It's 50% of the general fund dollars in the budget. It's a total investment of $9.4 billion. We have a positive revenue forecast projected out through the 21-23 biennium. And we've also realized some significant savings, some of it from the changes we made in the PRS system, some of it in public safety, but most of it in the healthcare transformation in Medicaid and in PEB. And we're hoping to extend that new care model to OEB as well. And the projected savings by the biennial savings by the 21-23 biennium are close to actually over $4 billion. So the point is there is an increasing delta inside the general fund that will allow us now to continue to increase our investments in public education, which is good news. The budget's organized around the three pathways with which you're very familiar: kindergarten readiness and third grade reading, high school and post-secondary completion, and then connecting education to careers. So there's a couple of sort of high notes I want to strike. The first one I mentioned earlier, which has to do with outcomes. The thing that unifies the budget from early learning to post-secondary education is an effort to focus on outcomes. And I think meeting our 40-40-20 objectives and ensuring success for all of our students depends on being more strategic in our investments and trying to have them leverage the outcomes that we're actually trying to achieve. So along with increasing funding through the state school fund and through the community college and public university support funds, I've also included proposals to change basically the current funding formulas in favor of outcomes rather than enrollment. I know that higher ed is engaged in this. I know that there is a range of views about whether this is good or not, going from this is really, really bad to this is very exciting. But we are having a very productive conversation with higher ed and the HEC around these issues, and I really do appreciate the willingness to have at least have that conversation. And I'm challenging the K-12 system to do the same. There are 3 formula changes in the proposed. One of them is around ELL. One of them is around career and technical education, and the third one is around ninth grade on track. These will generate a healthy amount of controversy and already have. I simply want to say, though, that if we continue to put the children's potential at the center of our focus, I'm sure we can shift these system incentives in the right direction. So whenever you do something like this, there are winners and losers. But let me just try to put that into perspective. If you have an English ELL program, and look just within the ELL population, you will be a loser if you continue to keep those kids in the programs and not actually successfully complete them. If you successfully complete them, you will actually be a winner. Now, that makes imminent sense to me. Now, we know across all students there will be winners and losers because of those are reallocated dollars, but that happens every fall with enrollment changes. But most importantly, this is 1.7%. 1.7% of the state school fund. So I do believe that this is an important debate for us to have. And, this population is a population in which we have to move the dial disproportionately. It's the fastest growing segment of Oregon's population, and it's a population that is lagging behind in terms of their opportunity to achieve. So to me, this is an issue of equity. It's an issue of really meeting the goal of 40-40-20. And so I know that we'll have a robust conversation about that. Any budget has trade-offs, so notwithstanding the savings we have and notwithstanding the improving revenue forecast, it's still a zero-sum budget, which means that we're going to have to make a macro allocation decision about the money we spend on education versus the other parts of the budget, public safety, social support services, et cetera. And then we have to make a decision about how we allocate those dollars within the education budget. It came as no great surprise to me that all of the major stakeholders agreed to my budget with lament that they didn't get enough money. That was true of higher education, K through 12, and community colleges. I'm not surprised, but I want to just say that as those particular stakeholder groups begin to advocate for their own silo, I think there's two things we need to keep in mind. One, if it's just about silos, we're defeating the very purpose for which we've created this organization. This isn't because the system is only as strong as its weakest link. So, secondly, the money has to come from somewhere. And I know this budget will look different when it emerges at the end of June than it does now. But the fact is that pulling more money into the education bucket out of other programs can jeopardize services that have a profound impact on the ability of students to learn. I have an article that I saw recently about the number of homeless children, school children, in the Beaverton School District, which increased from 695 last year to 841 this year. So the money we're spending on housing, for example, the money we're spending on social support services, the money we're spending on trying to keep families stable has a huge impact on the ability for kids to succeed. So this is not unlike how we've tried to change the paradigm in healthcare. If your objective is to deliver healthcare, it's basically about doctors and hospitals. If your objective is to make people healthy, it's not very much about doctors and hospitals and institutions, but it has a whole lot to do with housing and nutrition and stable families, et cetera. So I hope that we'll at least take that kind of a lens, at least in terms of going into the budget. So the major trade-offs were first trying to ensure that the budget reflects priorities beyond K through 12, which is very important, but also reflects our commitment to post-secondary education and the connection to work and early learning and preschool. Ensuring that we make investments to scale up the strategic initiatives that we've started that have been proven to help students move through those really critical transitions from pre-K to kindergarten and into first grade, and keeping students on track to graduate in ninth grade, which we know is very directly connected to the number of high school credits they have when they enter the ninth grade, and of course that transition from high school to post-secondary education. And then ensuring that we invest in reinforcing the system change work that we've started, and particularly the collective impact work that we're doing at the community level in our early learning hubs, and our STEM hubs, and our regional achievement collaboratives. So in addition to ensuring that there has been a significant increase in the resources available to the various state school support funds, we've also recommended investments outside the funding formula, as I mentioned. We've got $37.4 million in educator and school leader support and collaboration, which I think we could all agree is a nexus of our interests. We've invested to empower educators to pursue transformational practices and curriculum alignment and instructional strategies. The other thing I want to really emphasize is equity and collective impact. This budget was really put together through an equity lens. And it's just really clear to me that if we want to achieve our educational objectives, but also really our commitment to equity and opportunity, that we have to break down those barriers that have for years been very corrosive to the opportunity of children to learn, and that is particularly true of students of color and children who are living in poverty. So this is an opportunity to, I think, walk our talk. So throughout the budget, you're going to see an emphasis on targeting populations that are in need, as well as encouraging partnerships between institutions and community-based organizations that have a proven track record of actually moving the dial with these students. As I mentioned earlier, it's my intent to set sort of a larger table, policy table, to include the traditional educational stakeholders, but also parents, teachers, communities, community-based organizations that reflect those students that traditionally have not had an equal opportunity to succeed in our current system, and give power and voice to those people and bring them to the table, which is, I think, going to be absolutely essential if we hope to succeed. The budget does include $2.5 million to better integrate communities of color into our early learning hubs and our STEMs and our regional achievement compacts towards that larger goal. So let me just then touch really quickly on the three pathways. I would say the centerpiece of the education budget, which is the centerpiece of the state budget, is $440 million that is invested in basically creating a age 3 to grade 3 pathway. And it's that investment is based on a very simple proposition, and that is that if we invest at the earliest possible point in every child's learning and development, we will give them the best opportunity to succeed, and we will save huge amounts of money downstream in terms of remediation, in terms of dropout, in terms of costs in the social support system and the public safety system. And we have a real analogy, and that's the healthcare system. There's a clear parallel between investing in prenatal care and investing in early childhood development and learning. And you get the biggest return on investment. And you can't see it in 2 years, which is why we never do it. And it's also why we developed a 10-year budget framework. But if we're serious about really making this work, we have got to make those early investments. And in the healthcare parallel, if the objective is just to provide medical care, then you spend a lot of money on institutions, in that case, hospitals. If you want to create a healthy population, you spend money on prevention and wellness and the community-based management of various chronic conditions. And that's exactly what we're trying to do here. We're trying to have the discipline to invest on the front end for a sustained period of time. You know, there's an old story, and I'm sure you've all heard it, about the fisherman in the woods who sees a baby float by and runs in and gets the baby, and then another baby floats by, and this goes on for a while until his fishing partner runs upstream, and he says, "Where are you going?" And he says, "I'm going to go find the guy who's throwing the babies in the river." So unless we're willing to make and sustain this investment, we're just not going to make it over time. So it won't surprise you to know that this is the part of the education budget, and actually part of the general fund budget, that I am prepared to most vigorously defend in the budget process. So basically it's broken down into three lumps. One is full-day kindergarten, $220 million. One is $135 million in early learning and then $85 million we're calling a literacy package. But the idea is if you just have full-day kindergarten and don't link it directly with 0 to 3 and preschool, and then you don't link kindergarten in a thoughtful manner with professional development and curriculum alignment up to grade 3, you have another place to park your kids, but you don't actually get the outcomes that you want. So the $135 million actually builds on the work that we've already done with our early learning hubs. It reinforces our efforts to better integrate various different funding streams, and it basically reflects a commitment that investing in early childhood is the area where we get the greatest return on investment, and that meeting our third grade reading objectives, and we believe we can get 90 to 95% of the kids in the state reading at level in third grade within 5 years. And just think about that for a minute, what that would mean for success, for getting rid of the achievement gap, and for opportunity. But we have to meet our outcomes around kindergarten readiness and also stable attached families, which is where the social support services and the wraparound services come in. We know that the demographics in our state and our nation are changing, and they're changing particularly fast with very, very young children. So that's the point where we can really get the greatest opportunity to ensure not only that we're investing in early learning, but also that we are inclusive of the diverse communities and community-based organizations that really have been left behind. Investments in higher education. The budget reflects your priorities that when we had our last meeting about affordability and completion in higher education. We've expanded the opportunity grant in the area of affordability by 24% to $142 million. We have $500 million in the Community College Support Fund. That's a 7% increase over CSL. We have $626 million in the Public University Support Fund, which is a 14% increase. Last biennium, we focused on community colleges and had a 14% increase and a 7% increase in higher education. Is it enough? No. But I think that it reflects a serious commitment to try to redirect additional savings and growth from our economy, particularly in higher education, which has disproportionately taken cuts during the recession. In addition to the direct investments made into the higher ed support funds, we have $17 million invested in a 11 through 14 initiative that seeks to build a bridge between ninth grade and post-secondary education to ensure that students are both on track to graduate, but also were connected with a pathway to a meaningful career. We've also included in that an effort to replicate the Eastern Promise that has been very, very successful in that regard. And then finally, pathways to connect education to careers. Obviously, in addition to making sure our young people have a well-rounded education, we need to connect them with real careers as a foundation for our economy, but also to reduce poverty and improve equity. And I'll give you one example, a very real example, a young boy named Derek, who is a Latino, born to a single mother. Family struggled financially for a long period of time, often had to sort of choose between rent and groceries, and this young man had thought of dropping out of high school in order to get a job and help support his parents. His school got a CTE revitalization grant. They developed a real premier welding program. He got introduced to the program. Through that, he got connected to a $25 an hour job. He was able to stay in school, use the money to help his family, and now his aspirations go beyond high school. He wants to go to Oregon State University and get a degree in engineering. It actually breaks me up to think about it. There are stories like that all over the state. And so this really is about people. Sometimes we reduce it to dollars on a piece of paper. I want to tell you just a quick aside. When I was Senate President in 1985, we had a hole in our Medicaid budget. And the emergency board went down to fix it. And one of the things we did is we put a little money into it from the emergency fund, and we changed income eligibility and dropped 3,500 people off the medically needy program. And I remember sitting there in a room like this, looking out at spring happening and saying, boy, that was easy. We took a couple of votes and wrote some numbers down, and suddenly we'd balanced the budget. And then I went home to Roseburg, where I was practicing emergency medicine. And 6 months later, I started to see some people in the ER who were impacted by that sterile budgetary decision. and one of them was a man who had had a massive stroke because he could no longer afford the blood pressure medication. So, as we go forward during this legislative session, I hope that we can move beyond numbers on a piece of paper and remember that behind those numbers are faces and people with hopes and dreams and aspirations, lives of our fellow Oregonians. I think that's really, really important. So we've got a big connection to CTE, and here we've got the formula change that will give us long-term stable funding, and we've also got money to fund the CTE revitalization grants. We've also, and I guess that story of Derek is one example of how applied learning can actually pull children through high school instead of pushing them through, give them a real hope and a connection, something tangible. We've also got $15 million in STEM strategies and STEM hubs, and I believe that with that $15 million and then the total $24 million for CTE, the formula change, and the general fund dollars, that we can both improve student outcomes, increase high school completion, increase the number of kids who are literate in math and science, and increase the number of kids who get connected with all the high-wage, high-opportunity, high-need jobs that are out there today, and get a lot more CTE and STEM certificates and degrees. So I will stop there. Again, I know that anytime you start cutting the hog, as we say down in Roseburg, people come out of the woodwork, but I'm hoping that we can have a different kind of discussion. I know that there's going to be disagreement on this board and in the legislature, but let's remember what we're trying to accomplish, and I'm confident that we'll find a way to get there. So with that, I'll just open it up for any conversation you want to have around the budget. Ron?
Thank you. Well done. That's what I was going to say. Thank you.
Well, so do we have a motion just to embrace the budget here, or is it?
Well, I'll comment only to say I was in some conversations the last couple of days with some people who weren't so supportive. And I think what we have to remember is there's an inside Salem job, which you've got to do the next 6 months or so. But I know you keep in mind, but I'm just saying it again. We've got to make sure that there's an outside Salem message about why these changes are important too. Because, for instance, the changes to the formula, I think it's critical. I'd favor more changes to the formula, and I hope we evolve to more changes eventually. But those are hard. I mean, everybody, nobody wants to give up anything that's coming their way. So I think we've got to all work together with you to build an understanding, not just in Salem, but statewide, that these changes and tying a budget to outcomes really is where we have to go.
Ben, and then Dick.
Governor, I just want to highlight there's a higher education investment in your budget to the tune of about $100 million that wasn't really the subject of any discussion at the HEC or at the OEIB or really in the development of your budget because it was not a choice, and it was the increased debt service associated with projects that the state has supported over the past several biennia at community colleges and universities. When we look at sort of where the new dollars are going, it's a pretty significant increase in the state's funding of capital projects in higher education. Again, non-discretionary. These were previously obligated by the state. Now the bill comes due for debt. And I know for the HEC it was discussed a lot not because we had any option about whether or not to recommend paying the debt service, but because it puts real limitations on what's possible when you have a $100 million increase. That includes the OHSU bonds, in addition to the community college and OUS related projects, but a significant new investment in higher education.
Yes, Governor, I would just echo what Ron just said, and I think there's two things that came clear in what you were talking about. First of all, we're not talking about widgets here. We're talking about individual lives and those outcomes. But more importantly, what I like to focus on is not only the investment, but the costs of not doing. I mean, it touches everything in our lives. Every social ill that we can come up with can go back to the education process, which in turn turns to jobs and et cetera, et cetera. So I think it's important that we weigh the costs if we don't do, and that's pretty significant. And then I'd be interested on maybe on a private conversation, if you were chair of the Investments and Outcomes Committee, what 12 months from now, let's have some good outcomes.
Well, I mean, obviously, I think the outcomes that we're likely to see the soonest are in two areas. One is obviously in the early childhood kindergarten readiness arena, and I think the other one is in the STEM CTE arena, where you can actually connect kids in real time to to pathways to career.
Yeah, may I share just one? I carry this around with me, and you and I have talked about this. But Dick Alexander, he's a decade long of expanding early childhood programs. And Myers will say he changed tens of thousands of lives. But he always gave me that in the past we've always done it with this. This is a Band-Aid, and we're over that stage now. And I think he would actually be proud of us.
I just applaud all the work. I just thinking, as I was listening to you recap this, I'm just thinking of the journey that this group has been on over the last several years to get to this place. And I think back where we were 4 years ago, we didn't even have in our vernacular things like 11 to 14. And we have come so far. And when I listen to you read those off, and have read through, of course, the budget, what I hope doesn't get lost in the next several months of the session is we're talking about the right things for Oregonians. The numbers are going to be debated. And we know that already. You've heard that. But the issues, the strategic investments that we're trying to address are the right ones. You can't argue with STEM, CTE, early learning, 11 to 14. It will move the dial. And what I hope going through the political process that we're all going to be engaged in pretty quickly is we don't lose sight on the validity of the investments when we start losing sight of the numbers and the conversation around.
Yeah, I hope so. Obviously, it's a resource allocation debate we're going to have, and I think having a context for that's really important beyond just a 2-year event horizon, right? A 10-year sort of context for that. And then, I think the formula changes are obviously controversial. I know Mary's expressed a list of reservations, many of which I think are well-founded. But what I'm hoping is that we can have a conversation, right, and not go there. And I do have to say that higher ed is actually engaged in that conversation, and obviously they're very concerned about how it's done. It's easier to do it if you have more money, just as we had a little bit more money to lube the gears when we did our healthcare transformation. So that needs to be borne in mind. But to just not have the conversation, I think, would be a mistake. As you said, Mark, I mean, we are talking about the right things, and I think as long as we agree on what the right things are and where we want to end up, then I think we've got some latitude to sort of sort through the challenges as we move to get there. Yep. Elon?
So I was just sitting here reflecting on your fisherman story and remembering that I heard you tell that story in the year 2000 when I started on the Quality Education Commission. And so now it will be the fall of 2015, and we're investing in not throwing the children in the river. And so it's interesting. I wrote down that point because I think it's something that I will definitely use, and we have to remember is that one of the conversations we always had in Quality Education Commission is about, so when will we see the outcomes? And I think it's important for us to keep saying, we're not going to see it in 2 years, we're not going to see it in 3 years. But if we don't do something now, another 15 years is going to go by, right? So that really helped me because I think one of the challenges being on this board and then being in the system where I also hear the stories about, so what's the impact if we really can't fund what we're already funding right now in order to do some of these priorities? And so I think the kind of both and place for us to keep track as OEIB, because we are supposed to be overseeing the whole system, is what else is going on in those other decisions that also impact what's happening with the floor or the base or what's currently happening in the schools. And I know we were recently just talking about one, and I'll be testifying at the state school board, so this isn't to hang out any particular group. But I'm often in conversations in my own community where it's, well, they're doing this and they're doing that, and it's the they. Now, because I understand that, are different people, are different organizations, but we're all part of the same big system. Exactly right. So I think one of the things that will be really important to us, and I keep thinking about the chart Hilda put together just on the accelerated learning and the career and college ready, just keeping track of all that work going on is going to be so important across all the agencies so that we can see what's impacting something else. So I'll just give an example. In my school district, the conversation is, okay, we're going to fund full-day kindergarten, but there's a whole bunch we're going to have to do that's not necessarily going to be covered in that FTE allocation just for the kids in that classroom because it's one time and it's the first thing and all those kinds of things. And then our secondary folks are saying, but we're going to be the losers. Our kids are going to be the losers. So that must mean that the message is those are the throwaway kids. But that's not what we're saying. And if we don't make sure to balance the conversation with the other things and make sure that at our district level or any institution level where the decisions get made about how the money is spent, that we're not paying attention to those priorities. So I think that's the other part of the message, is that it's not just that these investments are to do these things, it's that they're pointing to what we think are the highest leverage, and the way in which we go about them through an equity lens is going to be the important piece.
Yep. They pointed direction. Yep. Nicole?
Sure. So I just wanted to appreciate and comment that I think that the creation of this budget, in particular the education budget, but many other aspects of the budget, has probably been the most inclusive budget process I've seen. I've now had the opportunity to hear from many folks that are part of the community who are invited to give input, perspective, and share their worldview on solutions. And I think that creates a totally different type of credibility and authenticity to this process. So I want to appreciate that. I also think the fact that this budget is so clear in the expression of evidence about the way that early childhood education and health are connected is really important to call out. And I actually think that outside of the education budget, there are many parts of the rest of the budget that actually deeply support these outcomes. For example, housing resources, a focus on mental health. I think all of those things are just very important to complement. And I also feel so proud that the state of Oregon is really taking a stand and saying that our success and our future is really embedded in the success of our low-income children and children of color. Children of color make up more than half of our 0 to 5-year-olds. They're 38% of our entire school-age population, including immigrant and refugee children. And I feel like we are finally walking our talk. And I want to appreciate and commend you, Governor, and your entire team and our OEIB staff. And, you know, we discuss many things at this board, and I don't think I've ever received as many phone calls and expressions of appreciation about the way that this board is leading and really tying our decisions to outcomes for children. So thank you.
Governor, you know, I was trying to think about the comment that Ron just made about getting your voice and your vision outside the Beltway. Because I think when you are representing what you've done here with the budget, your leadership with OEIB, it's very compelling. But it's a limited few of people who get the experience that we have of working with you very closely and intimately on the board and in subcommittees and in the process. I think it's essential at this point in time that more of Oregon hear your voice and definitely share this compelling vision for the budget and for our future. But I don't have a recommendation on how to do that. But I think it's essential, because I think once people hear that, you won't have any trouble whatsoever taking this budget through the process. It reminds me when I was head of child welfare, the way we got that budget through was that we went to every county and said, these are your children, we need your support. There's got to be a way to do that. And I really encourage all of us to think about how to do that, because it's a compelling message.
Nancy?
A lot of us are thinking about what we first heard from you when you ran the first time and the hopes and dreams we all had. And another thing I remember you saying that was really impactful for me is the story you tell of the woman who can't afford an air conditioner, so she ends up having a stroke and impacting her life substantially at a much more costly rate. And I think of this budget is changing systems, and I don't want us to forget that, because when I think of kids reading at grade level at 3rd grade, what I know is how much less money you have to spend on remediation up along the pathway and how much savings there can be there for others things. And then, like the woman, there's also, most important to me, is the cost on a child's self-concept when they're not reading at grade level by third grade is a lot. So I appreciate that we are trying to change the system. I know how hard it is. But without changing it, we're going to be spending more on remediation and less on prevention.
Anything else? Yeah, please, Mary.
So as an OEIB member, I can't fault this budget. I think it funds the things that we have discussed, and it makes the kinds of investments that I think we do need to make if we're going to change the system. As a college president,
Right.
At 500 million, we'll be cutting, we'll be closing programs. 40-40-20 will become for us at Lane and other community colleges as well. It moves from an aspirational goal to an unattainable dream. And that's the reality piece that I can sit here at OEIB and applaud this, and I do. I think these are really good decisions, thoughtful decisions, places that we need to invest. But there are going to be unintended consequences of this at local community colleges, not just at Lane. Other colleges have announced cuts that they're going to have to make at that level of funding. So I think we just need to be real about it is difficult to make these kinds of investments, but there will be other consequences that may stop us from serving the very students that we want to serve here, the most underrepresented, underprepared, first generation and poorest students that community colleges serve in this state. So
Fair point.
I want to have these conversations, but I think we need to do it with a little bit of dose of reality of what's going to happen on the ground.
Very good. Anything else? Well, then I'm going to tell you a story. One last story, because then it sort of gets to what Mary said, and she's right. I mean, I don't dispute that at all. But this just came to me. But I think there are parallels here that are at least worth noting. So the E-Board decision in 1980, actually it was 87, that resulted in these people, nameless, faceless people, getting disenfranchised with the stroke of a pen. The next year, the legislature discontinued funding for organ transplants in the Medicaid program because it was an optional service. And it was a totally non-controversial, unreported decision, largely because there was nobody who needed a transplant around when the legislature made it. And in September, a little boy named Kobe Howard showed up. He was 7 years old. He had acute lymphoblastic leukemia. He'd been in remission, had an exacerbation of his illness, and his pediatrician recommended marrow transplant as really the only option. And so he applied, his family applied, they were on Medicaid, but he was denied because we didn't cover it anymore. So his family started this fundraising, very public fundraising campaign. It was just heart-wrenching, and it went on through the fall, and he eventually died, I think, on December 3rd at Manual in Portland. Had only raised half the money he needed for a transplant up at the Hutch in Seattle, but he wasn't in remission, didn't have a match, so it probably didn't matter at the end of the day. But it was a terrible human tragedy, and it was also this sensational human interest story, and the media that had ignored the original decision descended upon Oregon. Al Gore showed up, and it was pretty amazing. And so the E-Board made a recommendation the next year to partially refund the transplant program for 8 people who were in immediate need, who had applied, and I actually opposed the motion. It was actually my first foray into health policy after having been in the legislature for 7 years. And to me, it wasn't really about transplants. The question was, it wasn't about whether transplants had merit, they do. It wasn't whether we had the $250,000 to buy the 8 transplants. To me, the question was, if you're going to spend more money on health care, where should the next dollar go? And what was the rationale to buy transplants for a few people who were covered with Medicaid when you had a pretty good benefit, when you had tens of thousands of people who didn't have any coverage whatsoever? And what was the rationale to buy 8 transplants as opposed to 8 or 18? And it was real clear that there was no rationale whatsoever. It was being driven by emotion, and we had no way of knowing whether spending $250,000 to give 8 people transplants was going to have a bigger health impact for the state than taking $250,000 and buying 10,000 women access to prenatal care. So, the motion failed, and what happened was we created the Oregon Health Plan, which was really an effort to prioritize dollars that we're going to spend on health care based on the outcomes long term, right? But what it didn't do is it didn't really look at the underlying healthcare system itself. So fast forward to 2011, what we actually did finally is it's not just about the allocation of public dollars, it's how you spend them and the system incentives. And so we have fundamentally transformed the healthcare system, right? And so I guess my point is, Mary's right, but there's no way you're not going to have those kinds of choices somewhere in the system. I mean, we're not going to get another $1 billion this biennium. So there are those decisions have to be made. And so to me, the question is, how do you get the greatest value for the greatest number of Oregonians? To me, that's the fundamental resource allocation question. And then the second question is, how do you transform the system? And so with the Oregon Health Plan, we've been working on that for 25 years, and we made more progress in the last 2 years than we did in the previous 2 decades. So you reach a tipping point. So if we are willing to at least continue to have these conversations and to acknowledge, as Mary says, that there are consequences for every budget choice you make. Every dollar you spend on one set of services are dollars you're not going to spend on another set of services. And if we're willing to continue to engage in that conversation, my prediction is that it's been 15 years, but we're going to have a sort of an exponential uptick within a few years if we can continue to at least keep these issues on the table and alive. So I appreciate you indulging my storytelling today, and we'll move on to the next agenda item. But thank you very much.
Governor,
Yep.
the moral of your story, that seems to me, is not just that there are tough choices about who gets the money, it's that you go a lot farther if you get smarter about how you spend the money. And I hope that part doesn't get lost in this budget. It's not just moving things from A to B.
Right.
It's sometimes getting a lot more value how you spend it.
Yep, exactly. Okay, let's
And
turn.
Governor,
Yes,
Governor, I was
please.
trying to see if I could get on this.
Oh, please, yeah. Hey, Hannah. Welcome.
Julia.
Was that Julia?
Anna.
That's Hannah.
No.
So, Governor, I want to just say that there's been a lot of work that's gone into the budget, and there's a lot of work, I believe, still to be done. But one of the things that I just want to point out is that there are stakeholders across the state, and they're referenced many times. I just want to point out, as a member of the OEIB and as president of one of those stakeholder groups, those stakeholders are the 42,000 educators that work with students every day. The administrators that are represented by COSA are the administrators that are in our buildings every day. And to ensure that we're actually reaching out to them as we're building these proposals and asking them, on formula changes, what would really work for students, I think would be a wise way to start the process and make sure that we're engaged in things that really will address the needs of our students. And also listening to parents. Parents have been clear around what they want, a well-rounded education and class size that meets the needs of their own child. So I appreciate the conversation, but didn't want to let it go unnoted that those stakeholder groups work hard every day, as well as our school board members who've been elected to represent each one of the districts. So thank you.
Yeah, thank you, Hannah. I certainly hope that no one assumed that I was taking them for granted. I mean, they are obviously key partners. They're key players. They have been and will be, and we'll go out of our way to make sure that they're part of the conversation, and look forward to the debate.